both the House and the Senate made a deal that struck a blow against the healthcare middlemen that manipulate our healthcare system to enrich themselves. Unfortunately, the very first act of the second Trump administration, or should I say the first Musk administration, was to step in and strip out the bipartisan agreement that stopped the drug middlemen, known as pharmacy benefit managers, from ripping off taxpayers and seniors. We all understand that health care is an unavoidable expense for most American families. That's why I went into public service. Health care is not a Democratic or a Republican issue. It's a family issue. And we know if you or your loved ones don't have their health, everything else in the house goes by the board. Unfortunately, the chaos sown by the president-elect and his billionaire mini-me, though again it's hard to tell which is which, they've served to protect the middlemen, the pharmacy benefit managers and insurance companies that take money out of the system while our families are stuck with big medical bills and substandard care. Now, Donald Trump has spent the last 2 weeks telling everybody who will listen that he wants to take on the drug middlemen. Let me quote Donald Trump here. He said they're rich as hell. He said we're going to knock them out. Well, at the very first opportunity to do that, he abandoned that pledge in order to follow Elon Musk's lead. You don't choose to do business with pharmacy managers, but I'll tell you, they are dining out on your paycheck nevertheless. These PBMs squat between big pharma and the insurance companies. While they're supposed to negotiate coverage and the price of prescription medicine for your insurance plan, they've ended up favoring higher-priced drugs by taking a fee that is linked to the price of the drug. Now, the effort to reform these PBM practices has been bipartisan from the get-go. It ought to be a no-brainer. I think I've told the President of the Senate. The senator from Idaho, Senator Crapo, and I kicked this effort off 2 years ago, and the Senate Finance Committee passed a bill 26-0. And the House of Representatives has worked in a similarly bipartisan way. Our legislation would end the practice of profiting off higher prices in Medicare by ensuring that a PBM can only receive a flat fee from drug makers. That's going to save taxpayers and seniors hard-earned dollars, because finally, these pharmacy benefit managers are going to have an incentive to pick lower-priced drugs. So let me just pause on that point for a second. These middlemen are not the good guys. Earlier this week, and I heard my colleagues talking about matters involving opioids, the New York Times reported that in negotiations with opioid manufacturers like Purdue Pharma, the pharmacy benefit managers traded away protections designed to reduce the rate of opioid overdoses and addiction in order to make yet another fast buck. These, Mr. President, are the people Donald Trump is letting off the hook at Elon Musk's direction. The bipartisan agreement, I might also add, is particularly important for us Westerners because we've seen our small independent community pharmacies hit so hard. These small businesses have been closing their doors at an alarming rate over the past decade, again in large part due to the practices by these PBM giants. The pharmacy benefit managers are able to pay independent pharmacies whatever they feel like. And then the little pharmacy in Arizona or Oregon or Idaho or anywhere else, the small pharmacies got to accept what the PBMs will pay. So what we do in our bipartisan legislation, what a number of committees in the Senate have worked on, what has been the effort in the House, and what our program is all about is giving the small pharmacies a chance to fight back by reporting unreasonable contract terms to a federal watchdog who's in a position to enforce a fair contract. That's going to mean that independent community pharmacies are paid what they're owed and keep their doors open in rural America without having to pay off the PBMs by gouging customers. Beyond the drug middlemen, I'm just going to mention several other areas, Mr. President, that the bipartisan legislation cracks down on in terms of helping the American people. The bipartisan legislation goes after ghost networks that are blocking Americans from getting the care they need. What these ghost networks are all about is essentially the insurance companies take your money and then there aren't any providers, there aren't any navigators, isn't anybody to help you get your coverage. So under what we are calling for in a bipartisan way, the insurance companies would have to have a list of doctors that actually are going to make care available. So Americans who need care can contact them, make an appointment, and not have to pay extra costs, Mr. President, by going out of the health care network they paid for. Too often, based on investigations conducted by the Government Accountability Office as well as the investigative staff of the Finance Committee, we have found that essentially these ghost networks mean there's no there. You've paid your money and you can't get access to real care. Either the doctors don't take new patients, nobody picks up the phone, you aren't able to get what you paid for. Finally, the bipartisan agreement that Donald Trump has directed be rejected. The bipartisan agreement strengthens requirements for insurance companies that sell Medicare Advantage plans to make sure that their directories are actually up to date. Once again, we're seeing an area that cries out for reform because Americans across the political spectrum are sick and tired of paying premiums for health insurance only to find they can't actually get care when they need it. So Medicare Advantage, ghost networks, these are the areas that we're strengthening in our bipartisan effort. I'll close by saying there's a lot more to like in the legislation when it comes to health care, continuing access to telehealth and Medicare. Again, Mr. President, bipartisan. The late Senator Orrin Hatch negotiated with me the chronic care bill, which had telemedicine provisions, which became the foundation for what we did to fight COVID, again during the Trump administration. But we're not getting the benefits of telehealth if we reject this bipartisan agreement, as Donald Trump is urging. So telemedicine is in our package, higher funding for community health centers. I want to commend Senator Sanders and Senator Cassidy for working in a bipartisan way on that. And we also have improvements to help moms and kids and Americans with disabilities and seniors with Medicaid coverage. Those, of course, are the dual eligibles, the folks who are eligible for Medicaid and Medicare. So I come to the floor simply to say, Mr. President, we've got the holidays coming up. Everybody understands that. But there's another gift we can give to the American people, and that is a more fair shake in American health care. We're spending enough money, Mr. President. We're spending over $4 trillion. There are 330 million of us. Divide the 330 million into 4 trillion. You can send every family of 4 in America a check for more than $50,000. Say, get your health care. We're not spending it in the right places. And I'll tell you, in many instances, the reason that's the case is because of these middlemen. They made sense 30 years ago when you didn't have all the technology and all the data and people who knew how to use it. But today, these pharmacy benefit managers are in too many instances ripping off seniors and taxpayers. And I hope Donald Trump will see that our bipartisan bill is important to do now, important to do before we go home, and get some relief to seniors and taxpayers. With that, Mr. President, I yield the floor.